Module Overview. Palliative care is not only about managing pain and medical symptoms, it is about caring for the whole person, body, mind, spirit, and relationships. The dying process often evokes deep emotional, spiritual, psychological, and existential experiences in patients and families. This module focuses on understanding, identifying, and responding to the non-physical needs of individuals approaching the end of life. These needs often include grief, fear, anxiety, regret, loss of purpose, existential suffering, guilt, loneliness, spiritual questioning, and relationship reconciliation. Through this module, you will develop the sensitivity, cultural competence, ethical awareness, and communication skills required to provide truly holistic care. By integrating spiritual assessment, psychological support, and family dynamics, you will help patients find meaning, comfort, and peace during the final stages of life. Learning objectives. By the end of this module, you will be able to describe the key concepts of spiritual, emotional, and psychosocial care in end-of-life settings. Recognize common emotional and psychological reactions to terminal illness and dying. Assess spiritual distress and existential suffering using validated tools. Support patients and families through grief, loss, and anticipatory mourning. Facilitate legacy work, reconciliation, and meaning-making conversations. Apply culturally competent and trauma-informed strategies in providing holistic support. Collaborate with chaplains, social workers, psychologists, and volunteers in a multidisciplinary approach. Section 1. Understanding emotional and psychosocial distress. Terminal illness often triggers intense emotional reactions. Common experiences include shock and denial, fear of pain, loss of control or abandonment, anxiety about the unknown or the afterlife. Anger, frustration, and resentment. Depression, sadness, and hopelessness. Guilt and regret, e.g., unresolved relationships or past decisions. Sense of burden or worthlessness. These emotions, if unacknowledged or untreated, can lead to spiritual despair, behavioral withdrawal, or refusal of care. Section 2. Spiritual needs and distress. Spirituality is not limited to religion. It encompasses an individual's sense of meaning and purpose, relationship to self, others, the divine, or nature, belief in transcendence or life after death, need for forgiveness, peace, or closure. Spiritual distress may manifest as questioning one's faith or beliefs, feeling abandoned by a higher power, loss of meaning or identity, fear of punishment or divine judgment, yearning for forgiveness or reconciliation. Spiritual assessment tools. FICA tool, faith, importance, community, address, and care. Hope tool, sources of hope, organized religion, personal spirituality, effects on care. Spirit model, spiritual belief system, personal spirituality, integration with a spiritual community, rituals, implications for care, terminal events planning. Section 3. The role of the care team. Palliative care teams must integrate support systems that address psychosocial and spiritual needs. Key collaborators include chaplains or spiritual care providers, psychologists and grief counselors, medical social workers, trained volunteers or community faith leaders, cultural or tribal elders. In traditional societies, holistic care plans must reflect the patient's beliefs, life story, social identity, and family dynamics. Section 4. Supporting the family unit. Family members also experience anticipatory grief, emotional overload, or complex family dynamics. Caregivers may feel burnt out or unsupported, conflicted about decisions, guilty for taking breaks, confused by changes in patient behavior. Financially or socially isolated, providers must include families in care plans, offer counseling and respite support, clarify roles and reduce tension, provide bereavement preparation and follow-up. Section 5. Grief, loss, and legacy work. Grief begins before death, anticipatory grief, and continues long after. Providers can normalize grief reactions, identify complicated or pathological grief, encourage legacy activities, e.g., letter writing, audio stories, memory books, facilitate reconciliation and forgiveness processes, provide bereavement, follow-up, and resources. Documentation and ethical considerations. Document emotional, psychosocial, and spiritual assessments. Record referrals and follow-up actions. Respect confidentiality and consent. Use inclusive language, e.g., spiritual needs rather than religious beliefs. Honor patient choices even when they differ from family or provider beliefs. Module Summary. Module 5 delivers an integrated, person-centered understanding of emotional, spiritual, and psychosocial care. When health professionals recognize and respond to these non-medical dimensions of suffering, they create space for peace, dignity, hope, and human connection, even in the face of death. Holistic care transforms palliative practice from clinical service to compassionate presence and ensures that no patient dies feeling unseen, unheard, or alone.